Super. I think a lot of questions around contraindications and specific issues that people may have, age or comorbidity related. Do we want to take a few of them? Like if I have a liver disease, should I take it? Blood thinner, should I stop the blood thinner before I take it? There are some other diseases mentioned. I don't know what they are, but I'll try and quickly Google it.
So if you're offered the vaccine, just take it. But with regards to blood thinners, this is very common and lots of people are really scared about it. So they need to know that if you're on aspirin or clopidogrel, you do not need to stop the medicines. The only problem is that when you puncture at your puncture site, you might have a little bit of a bleed around the puncture site. All you need to do is keep it pressed for 2 minutes after you've had the vaccine. Don't rub it, just keep it pressed. But if you're on anticoagulants like warfarin or acetrom and you're being offered the Covaxin, they tell you that you need to check your INR levels, which tells you how thin the blood is. Your INR levels should be below 2. So please check with your own doctor before you go to take the vaccine. They are not contraindications to taking the vaccine.
And leads me to another question. Actually, I'll come to it later. Mr. Kulkarni is asking a question, if I've taken a vaccine and there's been no adverse reaction, what does that indicate? I'm assuming he has good immunity.
Nothing really.
Yeah. You're fit and you're well at your age, Mr. Kulkarni. That's what it indicates. All right. Any other questions which are coming up? And we have hit the hour. So I'm going to open it up to questions, if that is all right, doctors. And I'm going to keep a track on the chat. We've tried and covered a lot of things. I'm going to see if we've missed something. Again, specific question. 75-year-old, diabetic, hypertension, other comorbidities, what precautions are to be taken? Blood disorder, situation of MS. I'm sorry, I don't know what that means. Low white blood count. Should I be taking the vaccine? SLE patient. Again, I don't know what that means. Is it safe for me to take? So these are some of the specific questions which have come up in case you want to take it up. I totally appreciate if they're very specific and it's a GP related.
No, I think the blanket statement, without being too microscopic, is that you should be taking the vaccine irrespective of any of these underlying comorbidities you have. In fact, as you have more on these comorbidities, you should be more enthusiastic about taking the vaccine because you are more at risk for getting the infection and a severe form of the infection. Now, if you have any particular questions, that is something to check with your GP about. But overall, the gist you'll get from most medical practitioners is that unless you've had a hypersensitivity reaction to a previous flu vaccine, none of the other diseases that I mentioned here are a contraindication, and it actually should be more reason to take this vaccine quickly.
Did you want to add anything, Dr. Chowdhury, or shall I ask the next one?
No, absolutely. That's correct. Especially people who are immunosuppressed, they should definitely be going, and people around them must be vaccinated in order to help them, because people who are on immunosuppression will not mount as good an immune response as somebody who has good immunity will respond to a vaccine. So in addition to them getting vaccinated, it's extremely important that all their family members should be vaccinated too.
I have two questions from my dear partner, Sharad Abhyankar. One is about nasal vaccine. Any thoughts on that? And the second question I'll just ask. It's on the chat, but I'll ask.
So I think the nasal vaccine is in development by Bharat Biotech, the one that's developed Covaxin. And I think once it comes, we'll know it'll be much easier for people, especially the question of blood thinners, etc., will be out of the question once they can take that. Easier to take, no pinpricks, etc. So we'll just wait and see how it pans out.